Hey guys, Tony here. So I want to talk specifically about Medicare coverage of lymphedema treatment. There was a Facebook question that came up right here. Jana asked that, quote, I had a Medicare recipient who had just been discharged from a full lymphedema treatment course, about 10 visits. She's asking me to wrap her and do manual lymphatic drainage, basically to maintain the gains from the treatment. Would this be considered wellness at this point? Do I just do cash pay with her? Okay, so let's take a look at the guidelines, right? Under manual therapy, specifically talking about manual lymphatic drainage, complex decongestive therapy, we've got some information about the common causes. We've got them discussing both primary and secondary, what the goal is, right? Restore normal or near normal shape, reduce potential for complications, reduce functional deficits. We've got information about, again, what it is in terms of what it consists of, skin care, manual lymphatic drainage, compression wrapping, therapeutic exercise. So it's saying that it's covered when there's physician documented diagnosis, the patient has documented signs and symptoms, the patient or caregiver has the ability, and this is the important part that I want to stress, the patient or caregiver has the ability to understand and comply with the continuation of the treatment regimen at home. So this is very indicative. Let's keep going here real quick. The goal of treatment is to reduce lymphedema in the extremity. It talks about different ways to do it. Down here in moderate to severe lymphedema, daily visits are usually required for 3 to 8 weeks. So in the Facebook post, she mentioned 10 visits. I'm not sure who discharged that patient after 10 visits, but nonetheless, the patient was discharged. 10 visits seems short relative to the expected 3 to 8 weeks. This is saying daily 3 to 8 weeks. And then education should be provided to the patient or caregiver on the correct application of the compression bandage. Therapeutic exercise component is covered under the therapeutic procedure CPT code. This is where I think we really want to focus for this topic. So when is it not covered? Conditions reversible by exercise or elevation, dependent edema related to CHF and other cardiomyopathies, patients who do not have the physical and cognitive ability or support systems to accomplish self-management in a reasonable time. This, I believe, is an important component when we're looking at medical necessity for a lot of conditions. And this is something that I quote a lot in my Zero to Paid Medicare billing course. Once I determine the patient either does have the cognitive ability to learn what needs to be done and be able to do it correctly, or does not have the cognitive ability or support system to learn what to do and be able to do it, in both cases, I'm done once I've effectively established, if they do have the ability, I've taught them how to do it, now they just need to do it. They don't have the ability, they don't have a support system, there's nothing I can do beyond that. I've established that covered services is done. I can be paid a cash rate to deliver the service in perpetuity, but in terms of what Medicare pays for as a covered benefit, we're finished at that point. And then, of course, down here, continuing treatment for a patient non-compliant with the program for self-management. And non-compliant isn't necessarily saying they don't want to do it. They just might be incapable of doing it. They might not have a support system that can help them do it. They might have a spouse who doesn't want to help them do it or hasn't helped them do it. These are reasons for non-coverage, which means, translation, these are reasons that you can provide the service on a self-pay basis. You would utilize an advanced beneficiary notice. We can get into that. I cover that in my Zero to Paid Medicare billing course, but this is your reference to transition from Medicare covered service to self-pay service. So I'll put the link to this in the description of this video. If you have more questions, post them down below. These are the resources that you guys really need to use to make your policy, to establish your decision-making process. I'll catch you guys on the next video.